Hi, good morning. My name is Jose Miranda Velasquez. This video is for BSN 225-21. This video is the administration of ophthalmic medication. I'm in my Nightingale scrubs. You can see my badge. I need to verify the doctor's orders for this patient. Once I have done that, I will go ahead and verify the 6 rights of patient administration. The medication administration. They are the right medication, the right dose, the right route, the right time. The right patient, the right medication, the right dose, the right time, the right route, and then the right documentation. After, I need to do a verification check of the medication with the EHR. The medication prescribed is Timolol, is 0.25% solution in a 3.4 milligram per milliliter. The order is for 1 drop in each eye twice a day. For this skill, there is no dosage calculations required. The medication is prepared and ready to go. This is the first step in verifying the medication within the MAR. I need to check this 3 times before I can administer any medication to the patient. I will gather my medication supplies and head towards the patient's room. We'll knock, enter, close the door behind me to ensure patient privacy and to avoid any HIPAA violations. Set my supplies down on a clean, dry, flat surface. Perform hand hygiene and introduce myself to the patient. Hi, my name is Jose. I'm a nurse here. Can I have you state your name, your date of birth, and medical record number if you know it? I will check that information with the patient's wristband. That counts as the verification of the 2 patient identifiers. Thank you, Mr. Miranda. Are you allergic to anything that we are not aware of? No? Thank you. Okay. Thank you. Allow me to look at my computer really quick. I will then get the medication and check it with the MAR. This is the second time checking. Okay, Mr. Miranda, I'm here because your doctor ordered you to have this ophthalmic medication, which is an eye medication. The medication is Timolol. Your doctor wants you to have 1 drop in each eye twice a day. The medication helps treat glaucoma. This medication is a beta blocker that's meant to reduce interact pressure, which is the pressure buildup in the eye, essentially. Now, there are some side effects to the Timolol. These side effects are blurred vision, sensitivity to light, and possible headache. If these persist or get worse, please let me know. Some adverse reactions to the medication are chest pain, shortness of breath, swelling of the face, tongue, or throat. We don't want any of this to happen. If it does, please let me know immediately, as they do require immediate medical attention. I will check on you after I administer the medication, but if you notice it's starting to happen before I, if I take off and come back, please let me know. Also, I want to make you aware that when the medication goes into your eyes, you may feel some slight stinging or burning. Any questions for me? No? Okay. Okay, I'm going to check my computer really quick and we'll get ready, okay? At this point, I'll check my medication a 3rd time within the MAR. This is the 3rd time I do so. We'll perform hand hygiene again. Sorry, I gotta make an adjustment to my camera. And don my clean gloves. Okay, for this medication to be administered appropriately, it is best that I lay you flat in the bed for the application process. This is to make sure that I get the medication to your eyes. I'm going to lay you flat on the bed. Okay, Mr. Miranda, are you comfortable? Great, okay. So I'm I'm going to start by cleaning the patient's eye. I want to start at the inner canthus and work my way out. You feel my hand, okay? I don't want to scrub the eye or put any pressure on the eyeball. Okay, Mr. Miranda, I'm going to clean your eyes out. We don't want any buildup in them. I'm going to take my wash rag and wipe away from the inside to the out. Now, I've already wiped the left eye. I will then use a different part of the washcloth and I will clean the other eye inside out, from the inner canthus outward. I will dispose of that washcloth in the wastebasket. Are you comfortable, Mr. Miranda? Okay, perfect. We're going to move on to the medication. At this point, I will take off my gloves, perform hand hygiene, and put on a new pair of gloves. So, Mr. Miranda, when I apply the drops in your eyes, it will sting. Try not to blink or close your eyes. If we miss, I will have to administer the medication again. When administering the medication, I will take off the lid. I will get a tissue and press on the cheekbone. I use that to expose the lower eyelid, exposing the lower eyelid and the conjunctival sac. I will place the medication within the conjunctival sac. I don't want to place it in the cornea. Using my non-dominant hand, I will press down on the cheekbone, exposing the sac. I will then take my dominant hand and let it rest on Mr. Miranda's forehead. Okay, Mr. Miranda, here we go. Can you look up? I'm going to bring the tip of the bottle 1 to 2 centimeters away from the conjunctival sac and place my droplet. Okay. My one droplet is placed. I will then throw away the tissue and get a clean one to use that to apply pressure to the nasal and lacrimal duct. Clean tissue. And I will apply pressure. With this, I want to let the patient know that I'm applying pressure as well. I will hold pressure for 30 to 60 seconds. This helps prevent systematic effect. For this video, though, I won't hold pressure for very long. Okay, Mr. Miranda, can you blink for me? There you go. I will throw away that tissue and grab a clean one, and then I will move on to the other side and do the same thing. So I have my clean tissue here. I will push down on the cheekbone to help expose the conjunctival sac. And I will have the patient look up. Mr. Miranda, look up for me. I will place my dominant hand again on the patient's forehead and the tip of the bottle 1 to 2 centimeters away from the sac. I will place my droplet. We'll dispose of this tissue. Grab a clean tissue to hold pressure to the nasal lacrimal duct. And again, I will hold pressure for 30 to 60 seconds. I won't be holding pressure for that long for this video. Okay, Mr. Miranda, go ahead and blink for me. There you go. Okay, Mr. Miranda, how are you feeling? Good? Any complications? That's perfect. Okay, Mr. Miranda, I'm going to sit you back up, okay? Alrighty. Mr. Miranda, are you comfortable? Okay, that's great. So Mr. Miranda's comfortable. I will dispose of the tissue and the gloves. I will finish my procedure. Now that it's done, I want to make sure that the patient is comfortable. Make sure the call ID is within reach.
I'm not quite sure how to help you with that.
Don't mind Alexa there. I will close the medication to ensure it's good for the next time. If it's a reusable bottle for this circumstance, I got the disposable one-dose vial, or the one-use vial. So I will throw all my stuff away, dispose of my gloves, perform hand hygiene, grab the medication vial if it's meant to not be disposed after the one use. If it's meant to be kept for multiple times, I will grab the medication and return that back to the medication room. At this point, I would exit the room, return the medication, and then document my results. Thank you.